Hello, my name is Carlos Marrero, and I have a question for you. What do you feel when someone tells you the word cancer? Does it bring you bad memories, uh, the fear, sadness, depression? Uh, maybe have a mix of emotions. Well, today I'm here to talk about the rarest of the cancers, Hodgkin's lymphoma. So, according to the Mayo Clinic, in their article Hodgkin Lymphoma on their official website, Hodgkin lymphoma is a rare type of cancer that develops in the lymphatic system, and sometimes it can be unnoticeable. The lymphatic system is important because this system helps us fight everything. Uh, Viruses, bacteria, parasites, that sort of things. And this cancer was discovered by Thomas Hopkins in 1832. This type of cancer is unknown, but they discovered that certain people are at higher risk than others. And some of the risk factors for this disease is the age. It's most common in early adulthood, so ages ranging from 20 to 39 years of age, or late adulthood, so 65 years of age and older. Now, it affects more males than it does females, and having family history of this cancer or having a weak immune system caused by HIV or anything else that messes with your immune system could very well be some of the risk factors of this cancer. Now, according to the American Cancer Society, in their article, Hodgkin Lymphoma, located in their official website, they estimate that in 2024, there would be around 800 to 57 new cases of this cancer. It is also reported by the American Cancer Society in their article survival rate for this particular cancer, the Hodgkin lymphoma. The 5-year survival rate between 2012 to 2018 fluctuates between 83 to 95%. And after reviewing this, we're going to be talking about some signs and symptoms. So, signs and symptoms of the lymphatic nodes could very well depend on the person. So, some people have reported feeling fatigue, weight loss of over 6 months, or just itchy in their skin after they consume alcohol. There are different tests to determine the stages and location of this cancer, but the signs and symptoms vary depending on their location and the stage of each of the cancer. Now, methods that they use to test this type of cancer is through CT scan or a PET scan with contrast. Now, contrast is a kind of a liquid that makes the cells go lining up like a Christmas tree. So essentially, once they inject you with that liquid in a CT or PET scan, they will basically see how advanced or aggressive the lymphatic node is. Now, some stages of the cancer obviously is from stage 1 to 4. And stage 1, you have the lymph node in just one area. Now, stage 2, you have more than one affected area. Now, it could be two ways. So in this diagram, you have stage 1 has it in the neck, stage 2 has it in the neck and in the armpit. So if you can see right here, neck and armpit. Stage 3, you have it more powerful in your neck. But you still have it under your armpit, in your abdomen, and then in your groin. And now stage 4 is where there are multiple lymph nodes that are affected, and in stage 4 you can see that it is more aggressive in the pelvic area, and then you still have some in your abdomen and the same locations, which is on your neck and under your armpits. So those are the locations of where some lymph nodes could be, and now this the location will be done by a test. Now this test depends on the system and the location. So if they do a biopsy or a CT scan and they locate it, they can extract it by biopsy to verify that it is the cancer. Now there are some good news about this, and that it is treatable. My wife had this and she's now in remission, thank God. Now some of the treatments are in test based. So according to Cleveland Clinic in 2002, their article Hodgkin Lymphoma, there are numerous treatments for this specific cancer, and sometimes the doctor has different options depending on the case by case. One of them is going to be chemo, which is all cancers have them. Second would be radiation, so a kind of localized radiation where they blast it. It could be on your neck, and then they just throw some radiation in your neck, so essentially to destroy it at its source. And now when all of that is said and done, they can do bone marrow transplant to knock out or eliminate any remnant of the cancer cells. Now, best case scenario is like you will be like my wife, that she had this cancer. They gave her treatments, and she was able to go along with these treatments and go in remission. Now, another thing that I realized that there are several other treatments, such as ABVD, so ABVD, and then all the list of medications, and it's typically given in stage 1 and 2. Then the second line of treatment, if that one doesn't work, is BEACOPP, another list of medications, and another treatment, like I said, radiation or chemo. And one thing to note is that there is still hope. So keep on fighting the good fight, and you'll go to the finish line, just like my wife did.